Can you hear me okay, Chad? Okay, good evening. We're going to call to order the regular meeting of the Boone County Board of Education for September 10th, 2020 at 7:30 p.m. If you would, please join me in the pledge to the flag. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for that. A couple of quick announcements before we get into the agenda. I do want to point out we are streaming this meeting on YouTube for folks that want to view the meeting but could not attend in person. Here in the room, we are spaced out. We're socially distanced. We've limited the capacity in the room tonight. We are adhering to the Healthy at Work guidelines. So those tell us if we are distanced, we can take our masks off. If we're at a podium addressing a group, we can take our masks off. And then we have quite a few folks wearing their masks as well. I also want to let everyone know Mr. Turner is ill tonight. He is participating fully in the meeting via Zoom, but just out of an abundance of caution, he decided we do the meeting remote. So hope he feels better, and thanks for staying in the game here while you're not feeling well. So that brings us to item 3, our student board member representative report, and Ms. Tony Clevenger.
So just a couple updates about the Superintendent Student Advisory Council. Recently, we have decided to put a new application process in order to get into the council, simply because in previous years, it has been a different process to get in and express your interest through each school. So we want to make it the same over the entire district. And for this reason, we decided to put an application process, which will be scored by a rubric in order to get new students into the council. And given this, we are trying to have a high school meeting by the end of this month, and just get things rolling, because we do have sort of a late start, but we are hoping to get those applications back and to have a high school meeting. Thank you.
Okay, thank you for that report and for getting things rolling. Okay, that brings us to item 4, our good news items. We did plan to recognize our retirees, as we do every year coming back into the school year, but with the current situation and limiting our crowds, we're going to do that at a later time. I do have one quick announcement. We have 2 teachers in the district that are semifinalists for the Teacher of the Year Award. Those are Tia Wood from Valley Shannon and Lori Knapp Lindsay from Ignite. Those are great accomplishments, becoming semifinalists, and we certainly wish them all the best as that process completes over the next few weeks. So that brings us to item 5, our audience of citizens. We do have, looks like 5 individuals that have chosen to speak tonight. What I want to do is I want to read our standard statement on audience of citizens, just to make sure everybody's on the same page on how we handle the audience of citizens. So the audience of citizens is a time for the board to receive information. It's not a time to discuss, to answer questions, or to debate a matter or core issues presented. We cannot legally, nor would we, discuss any issue of a specific employee or a student with respect to privacy. We do welcome your comments. If you have a concern that we'd like a response from this board or from the administration, please give your name and address or email before you speak so that we may contact you. If you wish to make a statement only and no response, you do not need to give your name and address. We will be taking notes. We will be listening intently during this session, and we will likely refer to some of your comments, or potentially refer to some of your comments later in our meeting as we get into discussion on matters specific to reopening of our schools. So that's our standard statement. We're fully expecting a few comments on reopening the schools. So a couple things I just want to say as the chair of the board. I do want to just remind everyone and redirect everyone to the resolution we passed as a board at our previous meeting. We do realize as a board that our kids, our students are best served in the buildings. We are committed to working very diligently with Mr. Turner and with the staff to get back to that reality. The district staff has worked very hard. They worked very hard all summer to put us in a position to be successful in the buildings, and that was delayed. We're working hard on the virtual model currently and working really hard on how can we get to a virtual model and beyond here in the coming weeks. So going forward, I want to make it clear that the buck does stop with this board and with Mr. Turner and with this district team. We were forced into some situations previously that we are working really hard to understand local data, to understand local parameters, to put in local protocols that we can operate under local control. So I don't want to get into the past. We're focusing on the future, and we feel really confident that we'll be able to operate under local control. So with that, and I do want to say later in the meeting, specifically with respect to reopening of the schools, Mr. Turner during the superintendent's report will be giving an update on where we are with respect to virtual learning, hybrid, and so forth. So that'll be a significant part of the discussion later. So with that, let's go ahead and call our individuals that asked to speak. First is Tiffany Schuessler.
Hi, thank you. Hello, thank you for letting me speak. My name is Dr. Tiffany Schuessler. I am a parent at North Point Elementary. I have a first grader and a fourth grader. I'm also a business owner and healthcare provider. I came to speak tonight because I, like many parents, are struggling with the virtual model with my children. My children are all of a sudden now in my office with me while I'm working, in an environment that actually puts them at a higher risk than if they were probably in the school building. My profession as a dentist is one of the highest risk professions for exposure to the virus. 3 of our positions in our office are in the top 5 risks for contraction of COVID. And yet our PPE that we wear in our office has protected us through all of this. There hasn't been a case of transmission from a dental professional to a patient or a patient to a dental professional nationwide documented yet by the CDC. Which means that our masks and things and hand washing that we were already doing and are continue to do are working. That being said, the Northern Kentucky Hospital Association recently published some data that said there's been 0 deaths in school-age children with minimal hospitalizations. So many of us parents would like to know if the school board or the district would be willing to give us better updates of where they're getting their data, which sources are they using, not just the Harvard model. We don't want to hear that. We want to hear the actual sources of data from the local hospitals. Have you contacted Cincinnati Children's Hospital? Because I talked to an administrator at Cincinnati Children's today, and they told us that they strongly support the children going back to school. They've had minimal cases at Children's, and that they feel like the kids would be best served in an in-person school environment. I do have some questions from some parents, though, that couldn't make it tonight, and they have some fairly substantial concerns. One of them is we have the 3-tier system set up to allow reactions to changing conditions and positivity rates, the red, yellow, green model. This allows us to quickly transition back to a virtual model, but not so easily back to an in-person model. Why is that transition so difficult? If we're trying to make this to where it's going to be flexible for everyone, we need to make the transition a little bit easier. We'd also like to better understand this as we move forward through the school year. More data, more updates. Where are we and how do we get there? How long will they stay in person and what conditions allow us to go green and go 5 days? If those conditions mean that we have 0 cases for a certain period of time in Boone County or the surrounding counties, we're a long way from getting there. So we'd like to know at what point do we get to go green? Or at what point do we just jump into the deep end of the pool and say, let's go, let's try it out? Have we contacted people in surrounding states, Indiana, Ohio, Tennessee, states where those kids are going to school 5 days a week. My niece and my nephew go to school in central Indiana, and my sister-in-law, their mother, is a kindergarten teacher. They've been in school now for 6 weeks, 5 days a week, full-time, with masks, and they've had minimal to no issues in their schools. They have higher cases than we do, and they've had more deaths in their state than we have. And yet here we are doing virtual school. Parents are struggling. I'm one of the fortunate ones that we were able to get some help so that I could continue to work, have my kids in my office, and still have someone help supervise them with their virtual learning. I wish I could be that person, honestly, but it's pretty hard to run a dental office and do virtual education at the same time when you're the only person in the office that is doing the work. The other question that we have is, there are many kids that have IEPs and 504 plans. Many of those parents have called and left messages or sent emails, and they've either gotten no response, or the response that they've received is, we have absolutely no idea what we're going to do with your children. Those kids need our support, and they need help from the schools. That's not an acceptable answer for most of us parents, especially for those of us with young kids that may or may not end up with an IEP this year and have needs that aren't being addressed. The other concern that parents have is that now, as we transition back to a hybrid model, that our virtual days will become recorded lessons as opposed to live lessons that we have right now with our teachers 5 days a week. We have a live meet every morning. We have live instruction for 4 days a week and for part of the day on Wednesday. But now we'll be switching to recorded lessons, and many parents are concerned that their kids are just going to zone out if they have to look at recorded lessons. I know we can't answer all of these questions tonight, but we just ask that you please address these questions and update us more on what's going on. It's the not knowing and the not having the updates and the questions when we call of the uncertainty and not being able to give us the answers that I think is stressing people out the most. We all want our kids back in school. I want my kids back in school. I feel confident sending my kids back to school. I think the schools are more than prepared. I think they've done a great job. I've been in our school recently. I've been up there a couple of times, and I see what they're doing, and it looks fantastic. I just wish that they could actually go in there and see their teachers. Thanks.
Okay, Brian Kinross.
Distanced. So I want to speak more about the social effects on our children. I've been a parent of a Boone County student for the last 19 years. My last student is starting 9th grade this year, and on her own volition decided to attend Ignite. She was very excited about the pre-nursing program, and because of the work that her mother and sister do in emergency response and nursing, she felt that would be a good way to jumpstart her career into that medical field. My daughter Malia has always been an AV honor roll student. She's a student athlete, competed for Ryle on the swim team for the last 2 years, and was influential in helping Ryle win a regional championship last year, and was one of 5 students that made it to the finals at the state swimming. She's very social and thrives on being with others. What I've seen my daughter become, this energetic, enthusiastic, intelligent student, with the learning program that she's been offered this year, I find her depressed, I find her angry, and I find her very upset about lack of socialization. Very hard to motivate her. The school that she attends, while the parent that spoke before, I'm jealous that they are actually getting live instruction from teachers on a 4-day basis. My daughter gets it rarely. Most of the instruction is recorded. And when I called a teacher about an assignment she was struggling with, it was due for a government class, found that he had provided instruction 1 day of the 2 weeks that they were in school, and that he had office hours to call her. The struggle she had was with an assignment that was posted online that was open for editing. And so a student went in there and edited this assignment they couldn't write on it, but you can change spaces and paragraph spaces. And so it was so jumbled up that my daughter couldn't understand the assignment. That's why she didn't get the assignment done. That's why she was struggling. So the model that we're using is really severely affecting our students. I'm concerned for the social well-being of my daughter, for the physical and the mental well-being of my daughter. She's been affected by sports being canceled. She's a competitor, swim meets being canceled. And so that's having a mental toll on her as well. But the education and the lack of socialization is severely affecting her. As was mentioned before, the data that my frustration with Boone County deciding to close schools is based on a Jefferson County issue, not a Boone County issue. The numbers are rising in just Jefferson County. I'm an engineer, I work for Procter & Gamble. The numbers are rising. The trend data was up for a short period of time, influenced by Jefferson County, not by Boone County. When this district decided to not take our students back to school in person, our trend was downward. And I don't understand from a local level why we don't have control of our local schools and why we're allowing a governor in Louisville, or in Franklin, not Louisville, but a county in Louisville to influence our decisions here in Boone County. I assume that your comment about local control gives this board, the board that we citizens here have elected to make decisions for us as constituents and members of this community. That is necessary, it's required. The effect on students is minimal. The effect on teachers, more at risk, but there is ways they can protect themselves, just as was stated. Medical doctors, nurses, my daughter's a nurse. She goes in a hospital every day, she's exposed. She has PPE that's protected her. Dentists, doctors do this every day. Teachers can wear that, teachers can protect themselves. Students, not necessarily needed as much. I would hope you consider making decisions for our county and not allow the governor of this state or other counties influence our decisions here. Thank you.
Okay, thank you very much. Mike Albrecht.
Thank you for taking the time to listen to my comment here. I have two students. I have a sixth grader at Gray and a 10th grader at Ryle. We opted for the hybrid model because we thought that the kids need to be in school. And I don't want to beat a dead horse on that point, but I want to point out something that I did make aware to the superintendent as well as their high school principals, that the Edgenuity program that you guys have foisted upon the public here, there was an article middle of last week that talked about the algorithms that used that to grade the things that people were submitting written responses that were getting answered within like 5 seconds. And so this professor actually looked at the algorithm that they're running, and it looks for keywords. And so she had her son put a gibberish comment in there, like 4 sentences, and then had a bunch of keywords from the study, and it came back at 100%. And if we think that's education, we're mistaken. And once again, I don't want to beat a dead horse, but the kids need to be in school. It's ridiculous that they're not. This was originally the lockdown. Everything was supposed to be to flatten the curve to prevent the overwhelming of our medical facilities, which never happened. And not one school-age child in Kentucky has passed away from COVID. And I'll bet you if you guys look at the studies in the past years, there have been some that have died from influenza. And there is no policy that Boone County has for closing down school for influenza that is even comparable to the results we're getting from COVID. Thank you very much. Good night.
Okay, thank you very much. Is it vested Mayhan? Vester, sorry.
I guess this doesn't fit in for your meeting tonight, but I have a question that I'd like to ask someone that is working on something, or I thought he was working on something with me. And I got a response that this letter will serve as to advise you that this matter is closed. I've been trying to get this problem looked at with other people, superintendents and principals that was involved at that time, and no one wants to talk with me. And he's closed it, but I don't even think he was in the county. Mr. Sheehy, did I get that right?
You did, yes.
I'm sorry if I
No,
mispronounced
you
your name.
you have it right.
So it involves a lot of work that I did. And I'll just tell you what it's all about. I was the #1 man to be called anything that happened on weekends and nights. We had in the school where I was, #1 man to be called. I was getting called at night. We'd have a drop on the intercoms and everything. And I'd go in the middle of the night, it might be 20 below zero, or I might get windows broken on Sunday, which I did several times. And I haven't been able to get any response or any cooperation on settlement. And I don't know if he's saying I'm lying about it. I don't know who he talked or who he discussed it with. But he didn't really get to discussing it with me too much.
So, Mr. Mann, it sounds like this is a personnel issue when you worked for the district years ago, and this board can address personnel issues. If you've worked with Mr. Sheehy, and I don't know if it's Dr. Poe or Mr. Turner, and they've given you a letter after investigation, it sounds like the process has worked its way appropriately. But we don't take feedback or input on personnel issues regardless of what it is. That's statutory. It's not a function of our board to handle those matters.
And I can't get a conference with people who had me to do this work and then denied me pay for it.
It sounds like based on the letter,
Well, I'd still like for somebody to listen to me to see if I was appreciated at all for what I did.
I'm sure you were.
Put any money in my pocket though. And I was called so often that one of the principals told me, he said, I'll give you a break this week and I'll be the first man to be called. And so I can't understand why I wasn't paid for it when I was kind of rooted out of the system.
Yeah, I can't answer that for you either. It sounds like it was a number of years ago, and the individuals on the team here within the district that are supposed to handle that have handled it for you.
And the principal assured me I would be paid for it, that requested me to do it.
Thanks for coming. I'm sorry it's been such a process, but it sounds like it's been handled, sir.
It's been handled very poorly. For me to put in the hours, the days, the years that I have for this system and get the treatment that I have on this is very poor operation.
Okay, thank you, sir. Okay, Sarah Cheek.
Good evening. Thank you for the opportunity to speak tonight. I think we all clearly understand the difficulty of the current situation, and we're not looking to minimize that in any way. We are, however, looking to make sure that this body continues to hear from the parent and student body. We want our kids in school. We want them in school 5 days a week, and we're ready and willing to fight whatever battles necessary to accomplish that. I'm going to read for you a letter that each of you received also in your inbox. I'm asking that Boone County approve in-person instruction for our children on or before 9/28/20. As a working mother of 3 children of varying ages, I urge you to support the decision that was made so loudly by the far majority of parents. We are absolutely crippling this generation of learners by continuing to virtually educate them. Our children are frustrated, they're lonely, they're scared, and frankly, they're already in front of their electronics far too much. Our children deserve to face the face-to-face instruction. They deserve the opportunity to be face-to-face with a mandated reporter. They deserve the opportunity to be guaranteed at least 2 meals a day. Our children deserve interactions with other children. They deserve to leave their houses. They deserve to learn from college-educated adults that aren't trying to split their time and attention across other children in the home or other children in the home and work. Our children deserve more than what we're giving them right now. I sent this letter to each of you. Mr. McIntyre, thank you for the response and for the call. I also sent it to the Board of Education in Kentucky, or the Kentucky Board. I also sent it to all of our local representatives. I also sent it to our governor. We understand what happens here is we feel like we're stuck in the middle, right? As parents, who do we need to talk to? What is the plan? I appreciate our first parent speaker saying we need the information, we need the updates. We are tired of being appeased with, hey, we're working on it. We're getting a plan together for you. It's not good enough anymore. I have in front of me the data for here in Kentucky, which a couple people have referenced. This is today's data, updated today. In Boone County, so far since the pandemic started, 1,377 cases. That is 2.55% of all of the cases in Kentucky. 2.55%. We are crippling our children because we are 2.55% of the Kentucky positive rate. We are at 3.84 positivity rate as of today. What does it take to get in person? What does it take to get in person 5 days a week, right? We're moving towards this hybrid plan. I appreciate 2 days a week. I do. We need 5 days a week. What is it going to take? Give us the information so that we can help get there. And then secondly, another parent, I think 2 parents actually referenced it as specific to the number of deaths. 0 school-age children, 0 children from 10 to 29 have died in the state of Kentucky since the pandemic started. We are absolutely crippling our children. We need them back in school. We're willing to do whatever it takes. I would appreciate a response, whether it's to my email or broadly to the rest of the parents who are also asking for the same thing via some sort of district announcement. And that's all I got. Thanks.
Okay, thank you very much. All right, that is all of our Actually, I'm supposed to ask, did anybody else want to speak that maybe was here and didn't hear late that didn't have a chance to sign up? So just give us your name, and if you want feedback directly from us, just,
Can I stay here?
sure.
Okay. So my name is Amber Elementary, and I'm also the mom of a severely autistic nonverbal Boone County student. And personally, as a teacher, I'm meeting with my kids. I am working really hard to do the best that I can. And to be honest, I'm a really good teacher, but I'm not a really good virtual teacher. And I'm highly educated. And this year, my second grade class started with 21 kids. Since the beginning, before school even started, as of today, I'm down to 15. These kids are being pulled out to go to private school or to homeschool. It's not okay. We're losing good kids, good families, and it breaks my heart as an educator. I want my kids, and I want to be in the room with them. I'll wear a mask, I'll wear hazmat, I'll do whatever it takes to get them into school. And as far as this guy, as a mom, he is being disserviced beyond measure. I don't even know how to express the decline that I've seen in his behavior. Sorry, buddy, but I'm going to talk about you. Like, he was at Ackerman Middle, 8th grade, and he was making strides. His IEP goals were being met. And you know what we had to deal with this whole week? And this is just me being a real mom. He's digging in the trash. That's what he's doing, because we are confined to home. He's bored out of his mind, and he's doing things that he hasn't done since he was a toddler. And this is a Boone County student, you all. He was in a really great classroom with some really great teachers, and his decline and his demise in his behavior and his learning has just plummeted. And I have the data to prove that, because once a week we get an ABA therapist who can come in our home and work with him. So I just want you to be aware that not all teachers are saying that we don't want to be with kids. We want to be with kids. And as a special needs mom, I need him. I need him desperately to get his services and to be with other kids who are like him, and even neurotypical kids who aren't like him, to model good behavior and positive behavior.
Okay, thank you very If you would mind just giving your name, if you want some feedback, address, you can fill this out later if you want. But
Yes, sir. My name is David Leaprom. I have a child that just enrolled in Goodridge, and I have another little one that Hopeful Church preschool goes off of what you guys imply on the county. I haven't been wearing a mask through this whole COVID. I have not contracted it. I've been to Tennessee, Georgia, Alabama, Florida without a face mask. I've never contracted it. I was in the United States Marine Corps. I've been exposed to a lot of chemicals and stuff like that. I worked in the oil field. So my immune system should be down than other individuals that have never seen anything like that, have been touched by chemicals that take off the skin and everything like that, like office personnel. So if I'm not contracting the COVID-19 and I haven't been wearing a mask for this whole time, and I tried actually, when I tried to get a job, because my business has been failing because of this COVID-19. So I went and got a job. I suffer from some mental aspects. This is why I'm not wearing one right now. I had a few episodes from just wearing that mask for 3 weeks where I, went into a state of depression, had to call for services from the police department. So with this mask thing for the little kids, what do you think that's going to, cause if we haven't even tested? The parents don't even know about depression or know the signs of it, because not all parents know that. Even the well-educated ones don't see the signs or don't want to see the signs. So all of a sudden wearing the mask is making them have episodes in school or even on this online stuff, which did hurt me, because I felt like I was failing my son that is just going to kindergarten at Goodridge, because it took us a week to figure out the codes and everything like that and get a computer with miscommunication or communication problems. And I understand that because that happens. So, I dealt with that and he's been doing actually good. So, the people that, see the online learning not working, it is actually working for my child. But it might not work for every child. And I was trying to look for the little site that I was watching earlier today. It said that, we have to think of how many children will have a upcase of ADHD maybe from all these visual learnings and from the computer itself. Because, us as parents say, well, we don't want to be for them to be on the computer on like a virtual or TV or game system. They want to be outside socializing with other children or just with the environment around them. So I'm taking a stance on that for them to go back into school. Online learning is good, but I want him to learn how to socialize with children because he's not very in tune with that. So social skills are declining, but his thought process and everything like that needs to prevail himself into a future of learning and how to learn from information that's brought to him. But he needs to know how the social cues work. And I don't think wearing the mask, because it's been proven that the children are less likely to be infected by so-called COVID-19. So they can tell people's, the other children's face, movements, eyebrows, everything that correlates to that. So they have the social skills for that. And that's all I have to say. And I do apologize if I walk out, it seems like something, but I have to go feed my children. So I apologize. And thanks for listening to me.
Thank you. Hey, is there anyone else? Okay.
Hi, thank you. My name is Maggie Sutter. I'm a nurse practitioner here. Prior to my current position, I was a nurse practitioner on the pulmonary team at Cincinnati Children's. And then all of my background as a bedside nurse was at Cincinnati Children's in the ICU. So I've seen a lot of kids in respiratory distress. I've seen a lot of kids with respiratory bugs. I can't tell you how many times I've taken my child to his primary care doctor and they say, oh, he has a respiratory virus, and they send him home. There's no swab up his nose. There's no waiting. There's no quarantining. We all have respiratory viruses every year. We just don't know which virus they are. We don't know the names of them. One of the things that's really bothering me is that we're going so much off of the number of cases. And I really think that that's irrelevant. Who cares about the number of cases? What matters is the morbidity, mortality. How many people are getting really sick? How many people are dying? That number is very low. It would not make sense if COVID went through a nursing home in our area and all of the case numbers rose and so we shut down schools. That doesn't make sense at all. Respiratory season is coming. We're getting into the fall and the winter seasons. There is going to be a spike. And I really think part of the reason we saw such a spike, a few months ago is because you could walk past a Kroger and get tested asymptomatic. I was really sick back in March. I went to the emergency room and I'm a nurse practitioner and they told me I didn't qualify for COVID testing at that time. They weren't handing out tests to just anybody. And then there's this huge spike in numbers. Well, it's because we're testing anybody who wants it can walk in and get tested. So my plea and my urge is to please not go off of numbers of cases. It's totally irrelevant. Go off of deaths, go off of serious illnesses, hospitalizations, and the age of the people that it's affecting. Thank you.
Thank you very much. Do we have anybody else? Okay, sorry about that. Okay, that brings us to item 6, recommended action consent agenda. Mr. Turner.
Thank you, Mr. Chairperson. I recommend the board approve the consent agenda items A through Y as presented.
The consent agenda also includes a treasurer report by Linda Shields. So Linda, you can move on.
Okay. We began the month with an adjusted cash balance of $30,264,405. Our total revenues for the month were $5,871,411, and with expenditures of $7,201,394, we had a net decrease in cash for the month of $1,329,983, leaving us with an ending cash balance of $28,934,422. We've really had a very routine month. There's not a lot to talk about. If you are looking at the report and comparing our expenditures this year with expenditures last year, this is shown on a cash basis, and it appears that we have more, about 3 to 4 million in local revenues from last year, and that is really simply due to a timing difference. We received some revenues very late from 2018 that came in July and August in 2019. So that's not a true gap that's showing. And expenditures are coming in as expected, but you will note that the transportation expenditures are a bit lower than they were last year at this time. We had debt service payments of $425,000, and I'll be happy to answer any questions. I've provided all the usual reports, and we'll answer questions that you have.
Okay, thank you very much. Okay, I have a recommendation. Can I get a motion, please?
So moved.
Motion, Dr. Brown. Second? Second by Ms. Byrd. Is there any discussion or questions on any of these items? Okay, all in favor, say aye.
Aye.
Any opposed? Hearing none, motion carries. Okay, item 7, recommended action, old business. Item A, board policy update, second reading, Mr. Turner.
Thank you, Mr. Chairperson. I recommend the board approve the board policy updates, second reading as presented.
Okay, thank you, Mr. Turner. Okay, I have a recommendation. Can I get a motion, please? Motion,
Second.
Ms. Byrd, second, Dr. Brown. Any questions here or comments? All right, all in favor, say aye.
Aye.
Any opposed? Hearing none, motion carries. Okay, item 8, recommended action, new business. Item A, district assurances, Mr. Turner.
Thank you, Mr. Chairperson. Thank you, Mr. Chairperson. I recommend the board approve the district assurances as presented.
All right. Yeah, okay. Is it slower or faster? Okay, so we have a motion, a recommendation. Could I get a motion, please?
So move.
Motion, Mr. Fry, second.
Second.
Second by Ms. Brown. Any questions on this? Okay, all in favor, say aye.
Aye.
Any opposed? Hearing none, motion will carry. Brings us to item B, the working budget for 2021 fiscal year. Mr. Turner.
Thank you again, Mr. Chairperson. I recommend the board approve the working budget for the 2021 fiscal year as presented.
Okay, thank you, Mr. Turner. Okay, we have a recommendation. Can I get a motion, please?
Second.
Second, Dr. Brown. Any questions or comments on this? I'll just say on behalf of Ms. Bird and myself on the finance committee. Thanks to Linda and her team for working through this. There has been a lot of iterations that they have to plan for, given the situation we're in. So thank you for that work. Were there any questions on what you saw or comments? Okay, we have a motion and a second. All in favor, say aye.
Aye. Aye.
Any opposed? Hearing none, the motion will carry. Just a second. Okay. Item 9, the superintendent's report. I will turn it over to Mr. Turner.
Thank you, Mr. Chairperson. And please excuse my absence, as you mentioned earlier. I appreciate the flexibility as I'm battling a non-COVID illness. First, I want to thank the members of our community that came forward this evening to talk and share information and share personal stories. We've received many messages from parents and from others in the community over the last month, and I appreciate the feedback and the concern and the care that they have for their students.
Hey,
and
Mr. Turner. Mr.
Yes.
Turner. Hey, hold on real quick. Try to speak up, and we're working on the volume here in the room. Is the volume that we're going to get it?
Perfect example where our kids up here.
So, yep. Is that a loop back to YouTube? No. Okay, Matt, let's try it again. And just speak up as loud as you can.
Sure. Okay. I'll try to do that there. First, I want to thank the parents and the community members that spoke this evening and came forward with information and personal stories and some of the hardships and the difficulties they're having during this time. I appreciate that feedback, and we've received the same feedback from other parents as well in other communities over the past month. So I do want to know that we appreciate and honor that feedback. Second, I want to thank our teachers, our staff, and our administrators for their work over the last 3 weeks. They've put forth.
This is
If
just.
you're listening to it, they can hear him. They just can't hear him. But online, they can hear.
Matt, are you pause? Yeah, pause just a second. I mean, he sounds perfect here, but in here he doesn't.
It's just not coming over this speaker for you all.
Okay, Matt, let's, I guess we're just gonna have to go. We can hear you fine through the YouTube feed. So
Okay.
we'll have it captured on, recording. And for those who in the room, if we can't quite grab it all, we'll have to go back and watch it.
Okay, thank you. I'll go ahead and just pick up where I left off there, if that's okay. Just mentioning our teachers, our staff, our administrators, they put forth great effort and care in helping our students and their families start this year on remote learning. And this has been a difficult task, and I'm very proud of their work and what they've done so far. Quite literally, they've risen to this occasion. During my visits to schools, our staff have been working very hard to engage students and to make their virtual classrooms the best that they can be. In this current time with the pandemic, everything we do seems to be much more complicated and more challenging. We all know and agree that our parents and their jobs and their caring for their children has become more challenging and more difficult. This is also true for our students, as growing up and going to school has become more difficult and more challenging for them. And this is also very true for our schools and for our teachers and for their staff. The typical everyday processes of school have become much more difficult and much more challenging. One small example of how challenging and how difficult processes have become, one example would be high school athletics. We've made that decision to allow a relatively small group of students, compared to our 21,000 students overall, to voluntarily participate in fall sports, following the guidance of the Kentucky High School Athletic Association. To successfully host these events, however, our coaches and our players, they must follow specific safety protocols. We'll have to limit the number of fans. Well, our schools will have to coordinate electronic ticket purchases with other schools. Our athletic directors must facilitate paperwork, forms, and tickets for each visiting player. This information must be quickly processed and organized for the purposes of contact tracing if necessary. And our school must recruit and pay additional people to work at the games to assist with safely managing all aspects of the event. If you translate that to the thinking of the normal everyday activities of school, it can be very overwhelming if you closely consider that. Each activity in the entire school has multiple layers of planning, management, collaboration, and execution. Our administrators and our teachers have been working on the normal tasks and the procedures in their virtual classrooms for the past few months. They've been working hard over the summer to get ready. They're now actively working on the processes and activities for small groups of students and for the AB hybrid model that we had presented in the summer. Our plan to transition students back to in-person instruction is a measured approach, where the first step is providing the opportunity for our teachers to develop the rhythm and the cadence of their virtual classroom activities. These routines and procedures, they build confidence and they build a sense of comfort for students. Next week, we'll take the step and bring in small groups of students in the transition grades, so that these students, many of whom have never entered their new school, that they'll have the opportunity to meet their teachers, to meet their administrators in person, and familiarize themselves with the building and familiarize themselves with the safety protocols that must be followed in that building. And during those 2 weeks, we will also utilize our buses to transport students and our school kitchens to provide food to take home. On Monday, the 28th, we will start in-person classes using our AB hybrid model. During the first few days, we will teach and train our students on the safety protocols required, just as our teachers will start the processes of developing that rhythm and that cadence for in-person classroom routines. I believe that we all agree that in-person learning is the most effective way for our students to learn, and it is the best way to meet the social, emotional, and mental needs of our students. Our plan is to safely and efficiently return to in-person instruction and use the data to make decisions on the status of our schools as our district as a whole and individual schools. And that is county and regional COVID-19 data. That's quarantine data and how that quarantine data may impact our schools. And that is also the successful implementation of our school and health, our safety protocols that we have to follow within our schools. We have to be able to effectively execute those protocols within our schools to keep our students and our teachers and the rest of our staff safe. We've also been closely following the work of Harvard's Global Health Institute and Cincinnati Children's Hospital Medical Center in concert with our own red, yellow, and green district status model. We've also consulted and collaborated with St. Elizabeth Healthcare, the Health Consortium, and the Northern Kentucky Health Department. This building up of the capacity of our schools to open and then be prepared to adjust in either direction is extremely important as we move throughout the school year. Our plan to transition back to in-person classes allows us to do a few things. Our plan to transition back allows us to meet some of the needs of our students in our transition grades as we get them acclimated to their new schools, to build the confidence in our students, our employees, and parents through each step of the process. It allows us to let our teachers to better manage the work of remote and in-person instruction, especially those classroom routines and procedures, the rhythm and the cadence that all teachers work to develop to build confidence and to build comfort with their students in classes. It also allows us to build the capacity of our entire organization, all 26 schools, 3,500 employees, 21,000 students, to shift as necessary from red to yellow to green or back throughout the entire school year, not just this immediate time. Just to close, in my opinion, it's best to view the entire school year as a marathon and not as a sprint. We must be intentional, we must be measured and moving forward so that we can increase the capacity of our entire organization so that we may function effectively for the entire year. And therefore we can effectively meet the needs of all of our students in all 26 of our schools. Thank you very much.
Okay, thank you, Mr. Turner. Are we still? Okay, we've still got the issue here in the room. So a couple of questions that I'd like to pose, and then we'll just open it up for discussion. So the path we're on is headed towards hybrid model starting September 28th. I think the basic question is how, if tomorrow was the 28th, would we be opening on a hybrid model? I think it'd be good for us to speak into that. Have we reevaluated as we go forward, or as we've been going forward, getting back before the 28th? And if we have, what are the challenges or the reasons we can or wouldn't do that? I think that's probably just, that's the basic questions for now that I think we should be able to speak into a little bit.
I think the data at this point in time leads me to believe we can go back to school. One of the major issues, as I just laid out, is the process of getting to that point to effectively do that and safely do that for all of our students in all of our schools, and also understanding the capacity of all of our staff to make that transition. So, as I stated earlier, our thinking is to make sure we have a measured process in which we can build the capacity of all of our schools and all of our teachers, all of our staff, all of our students attending the schools to follow all the safety protocols, to get people acclimated to their buildings. It is a building process, building capacity to be able to handle anything that may happen over the course of the entire school year. So answering your question, I think I did at the very beginning, is yes, we will look at the data and make decisions moving forward based on that regional data and that local data. And it'll be a contextual decision in concert with the school board on what are the numbers we're looking at, the different numbers. As I mentioned, it'll be things like the isolation numbers or the quarantine numbers that may affect some things at schools. And also we will be in a position to make decisions for individual schools and decisions for the entire district as well. So if we have an issue where there's a number of cases in one particular school, we'll make a decision based on that school, not on the entire district if we have one school that has an issue.
Okay, thank you. That helps. If I may, I'd like to, might be heading into waters here you all don't want me in, but I'd like to add a little color to the data we are going to look at. There were some questions about that and some opinions in the room. And this is coming directly from Cincinnati Children's in St. Elizabeth. So I think Dr. Schuessler, you referenced Cincinnati Children's. I would recommend going and listening to the 3 forums that they did over August and through September the 2nd. So September the 2nd was their last one. They very clearly, their first statements are, We're not here to approve, endorse, or reject any plans. We cannot make specific recommendations to school districts. But what they do provide, and is very helpful, is metrics that they would recommend we use as a school district. But they can't make decisions for us, and they will not give us a recommendation that we can live on. St. E won't either. I mean, we've talked to them. They will not go on record and say, if you do this, we would endorse your plan. They're just not going to do it. But they're being very valuable partners in this process. So the guidance we've gotten from them, and you can go listen to their webinars they've done for the schools, is first, look at the cases per 100,000 in your area. Second, look at positivity rate, but that's a pretty far second, because positivity rate's pretty messed up. The new cases per 100,000 is a 7-day rolling average. So actually, I kind of misspoke. So look at the cases per 100,000, 7-day rolling average. Secondly, look at the trend. So are you trending well? Then look at positivity, but positivity is pretty screwed up. So it's just kind of a secondary measure, they call it, right? So, I mean, those are the primary metrics, with some of the more qualitative stuff that Mr. Turner talked about. What's going on from a quarantine perspective in our buildings. Did we have a case or two and we had to shut down several rooms? That might happen. Are we able to effectively implement our protocols? We might not have bad numbers, but if we find that we just can't pull it off, we don't expect that at all. But those are more qualitative numbers that we're going to look at. So you can't necessarily paint it in a box of, if this, and this happens, we're going to go back, or we're not going to go back. It's a combination of factors. It's a science, and it's a little bit of an art, is my opinion. So I think that helps speak to the path we're on, the data we're going to look at. All that data is trending very well. So like Mr. Turner said, if tomorrow was the 28th, we'd be on the hybrid model tomorrow. I feel very confident saying that. So what about the piece of reevaluating the timeline and why we wouldn't be able to get to hybrid by the 28th, or before the 28th, I'm sorry, before the 28th?
Well, Mr. Chairman, as I mentioned in my remarks earlier, one important piece that we have to consider is the processes that we have to work through to bring our students in, train them on all the safety protocols to get them to feel comfortable, and also the capacity of the organization to manage things. Because right now, our teachers and our administrators are working very, very hard on virtual instruction. And they're also working very hard on small groups coming up in the next 2 weeks. They have third on the list of things they're working on right now are yeah.
Sorry. I think Karen's going to try to call you, and we'll see if we can get you on a speaker here in the room. That might help. I don't know if you'll do it.
Okay. All right, I'm on right now. Are you okay with it? Can you hear me?
Okay, that seems to work. Let's try that.
Okay. Okay, so thinking back to what your question was, in terms of the organization, and I'm having some feedback in my own ears now, so hang on. So I'm going to have a hard time hearing you for a moment until I finish speaking, okay? In terms of moving forward with our plans as we have right now, and I said earlier in my remarks, starting school at any point in time in any structure is an extremely difficult, extremely challenging task. Excuse me just for a second there. is an extremely challenging and extremely difficult task. Right now, our teachers are working very hard on virtual instruction. They've also been working hard here this past week and a couple of days since we started the process with small groups and bringing in those transition grades. Third on that list is their work on going back to the AB hybrid model, that they're doing that. So each of those are 3 really big and really different tasks for our teachers to take on. So we're talking in part about an organizational transition process of being able to move quickly between those. So what we've set up is this measured approach to build capacity within both of our students and confidence as well with our students, with our staff, with everyone involved, that we can execute everything that we need to do to be successful with that. A false start could create some major difficulties that it may take more time to recover from. As I said in my remarks there, it's my opinion that this approach will allow us to build things up to moving past the 28th. We can then consider where we may go at that point in time. But we do have to understand the volume of work that our teachers, that our administrators, that everyone involved are putting into everything they can right now. It's not simply turned around real quickly. And as I said earlier as well, starting school in the best of times is extremely difficult, extremely challenging. We're still wrestling with a few issues right now with virtual learning and trying to make sure we have everyone connected. We're getting hotspots in place. We have some other tasks going on to try to make sure we can do that as effectively and as we possibly can. We want to do that no matter what form that we're in. But the capacity of teachers to be able to manage all 3 of these things that we're talking about right now, that's of real concern to me as the superintendent. I do need to make sure that I monitor the workload, the stress load, the pressure, and the difficulty that our teachers and our staff are undergoing in all of that. So that is part of it. We want to build things up so that once we get to that point, we have the ability to move in either direction based on what the numbers in our community, the numbers in our region here affects that as well because of the number of people that may commute and travel from county to county for work. That may affect us in a certain way also. We want to look at all of those things and be able to maneuver into any direction that we would want at that point in time.
Okay, thank you, Mr. Turner. I should have said this earlier. I hope it's really, really clear. We want to be back in school. I mean, we're working. I mean, I work on this minuscule compared to the rest of these people in here, but I mean, me personally, I've been on calls with children's, I've been on calls with pediatricians, I've been on calls with St. E. We're trying to get to a point where we feel really good about moving forward. So, what's that? Yep. Yep. We're working towards that. So, do any of the other board members have questions or comments they want to make?
Clearly, it's obvious that we're not just going to say, oh, the Kentucky positivity rate is X, Y, or Z. That's what's going to decide what we're doing. We're trying to work with local health experts, but as Mr. McIntyre mentioned, you can sit in a meeting with 7 people from St. E and they will support you and they will provide data, but no one's willing to recommend or endorse whether you go or whether you don't. So it is. And I know a number of board members who have gotten personal liability coverage for themselves for the decisions that school boards are going to be making. And that's a big question to ask people, right? The other thing I haven't heard, I've heard a lot of students, I haven't heard a single person where it is not just children under the age of 20 that are in our buildings. And I think we're trying to balance protecting those teachers and protecting our staff and our faculty. I'm a teacher, I get it. Right now, I'm working 60 to 70 hours a week to provide quality instruction to college students. And it is killing me, literally killing me, right? It is so hard. I am draining myself empty. And I get to see my kids 4 times the whole semester face-to-face because I'm a science faculty member, right? So I am working harder than I've ever worked in my whole life. This will affect my tenure track, right? I'm not doing research because I am working literally when I'm not at home with my 4 children at the kitchen counter until midnight doing functions for Algebra 2 honors until midnight. Then I put her to bed. I work until 2 or 3 o'clock in the morning on my class for my students. I get it. We're all drowning. And I think the goal is to balance, not dipping everybody under while getting our kids back in school. Yes, getting our kids back in school is absolutely important, but I think we have to do it correctly, or we're just going to turn back around and be right where we are. And I've seen it. I've seen 5 of my nursing students test positive. I've seen whole cohorts go into quarantine. And we can't control who goes in quarantine. That's the Northern Kentucky Health Department. When we get a positive case, they're in control of who gets contacted and who goes in quarantine. We don't just say, oh, it's just Mrs. Smith. It's the Northern Kentucky Health Department that's in charge of that. So I feel the concerns of our parents. Absolutely. I have 4 kids. I have gifted kids. I have kids with an IEP. So it's not that I don't understand what we're going through, but I hope that people can realize that we're trying to step back and take a measure of how can we do this most effectively? How can we protect our teachers? How can we protect our kids? How can we get protocols in line? Because I can tell you, getting a 19-year-old kid to wear a mask properly just about killed me in lab, right? They wear them down, they wear them up, they touch them, they won't wear their goggles, they don't like them. I was the mask police for 3 hours in lab, and these are adults, well, borderline adults, they're college kids. But so I think we have a big task on our hands, and I hear you're like, well, the college kids or the Catholic schools are back, and there have been some that have had challenges. They've had classrooms go out. I mean, there's 56 kids that are quarantined right now at Seton because they were on the cross country team with kids who tested positive. It's not without its challenges as well. So I hear you, and I think we're trying to balance it as effectively as we can. And I think that's all anybody can do, right? Work as hard as they can and balance it. And I think that's what we're trying to do. Yeah. But if you have enough teachers who don't feel safe, they have options that include retiring, taking a year off. And we have a number of teachers who have chosen that route. We have to keep effective, highly qualified teachers in our classroom. And I think that's going to be a really big challenge moving forward. It is. Yeah. So that's it.
Anyone else? Any questions or anything you want Mr. Turner to address?
Mr. Chair, what I want to share with Superintendent Turner is that when this process happens, and I know we've been delayed from where we were originally a month ago, I just ask is when this Band-Aid's ripped off and we go back, that regardless what the state comes out with, that we stick to plan. Not only do the parents deserve that, but at the end of the day, our community deserves it. And you've heard 7 different parents share their feelings tonight, and I agree with them on a lot of things. I do go back in terms of what Dr. Brown shared, the fact of the number of teachers we have versus private schools is not just 1-to-1. We're talking a half dozen to several dozen to several hundred, if not several thousand of what we deal with. So it's much different. And I will tell you, I have a child in private school, and I have children in public school and have had children in public school. So there's a big significant difference here in regards to the calculations as far as with our teachers at hand. In addition to that, when plans are made, I hope that we stick with them, regardless of what it may be over the next week, 2 or 3, and that we move forward. I think that's another concern to a lot of the parents that weren't here tonight that have reached out to some of us, that even when we start back, that we be sure that we move forward with that plan. And to Superintendent Turner's credit, I think he's being very careful on that, which we appreciate, but we don't want to go backwards once we start. I think most of the board have heard me talk about this, if we've had individual discussions or not, that all of us are tired and frustrated and we're ready to move forward. But after a phone call that I had today, especially with, with one of our departments, I realized that there is parameters regardless of putting all kids back in school. I go back and say, look at the COVID considerations for reopening schools dated September 2nd. Even though we want all still students back in class, read what they write there. That's another thing to go back on. Even though the state may say we have local control, which we do, there's still parameters that we have to follow. And then we're guided about it. I may have a child that's struggling at home in 7th grade, but at the end of the day, I got to be sure as a district, along with this group, that we're covered with liability. Because there are going to be cases that it's going to come at us because it's not going to fit everybody. But one thing I do want to say, not only for Mr. Turner's sake, but also for our district's sake, for the people that go on social media to become subject matter experts, I think if you do the right things on either coming here tonight, which we appreciate what you've done, and put it in email or make a phone call, I think that's deliberately the best way to try to get to the ends of the mean here, rather than becoming an expert just because you just talked to a doctor and now you need to put it on social media. It slows our process down. Again, it slows our process down. My neighbor's a builder. I don't think I can go out and build a house tomorrow night. My other neighbor's a doctor. I don't think I can perform surgery tomorrow. Well, what I can tell you is that it slowed a lot of people's business down in terms of making decisions, the right decisions for everybody collectively rather than individually. And eventually it's got to stop. And I just wanted to put that on record, Mr. Chair, that I know that we've got a good plan going forward, even though we may not agree that we were hoping it would be sooner. But do keep this in mind. Government is unique. There's semantics at play, and things will come out of the last minute of the 11th hour. And we got to be prepared and ready that when this happens this time, that we do move forward with our plan. And I think being safe in terms of what we have done at this point, it's probably better in our odds in the right manner. But at the end of the day, I just hope that when the plans are put out, the principals can lead their schools, teachers can move forward, and that our students can move back in school.
Okay, thank you very much. Anything else? Any other questions for Mr. Turner or discussion items?
I would just like
It looks like nobody wants
to. Takes me a while to get my mask off and deliberate. I just have to agree with my esteemed colleagues because tonight's been very frustrating just for us, technologically speaking, and trying to figure out how our teachers make it work, because I know they've had technological issues as well as families have. We are listening and we are hearing, and we have been listening and we have been hearing. And regardless of how much Frankfurt spouts that we do have local control, as Mr. Fryman has already said, we do, but we don't. And because of regulations, statutes, whatever they want to set out for us in certain aspects, our hands do become tied and we're put in difficult situations and held over a barrel. And we all made a decision to delay till the end of September. And it was definitely not a decision that anyone sitting at this table wanted to make. and I'm still not over it. And I won't be over it until we get our kids back in school and they're back in school full time with teachers like we saw tonight here who are just on pins and needles to get back into the classroom with them. But Dr. Brown, as she has so widely said, it's a balance, and we have to balance it right for students and staff. But we surveyed, we've asked, and we've gotten the response that the majority of our staff and the majority of our community wants kids back in school. And I think it's our responsibility to get them there sooner rather than later. While I could not completely hear all that Mr. Turner, I'm sure, so eloquently said tonight, I'm familiar with what our plan is. However, we can expedite that because I think we have the best minds in the business working on it. I'm all for. And I wholeheartedly agree with Mr. Fryman that once our plan is set this time, we move. And if Frankfurt doesn't like it, too bad.
Okay, thank you.
Karen and I kind of deliberate and then we come in at the end. I completely agree with my colleagues here on the board. We want the kids back in school. We know this is what they need to be back in school. But as Dr. Brown mentioned, it is a balancing act. And I have come across so many, not only students and families that are traumatized, but we have teachers that are traumatized through this. We have to take care of their mental health. We have to do this very carefully. We have to get them comfortable in the buildings, and we have that first step. They've been in the buildings, they've been working together, they've been teaching their kids virtually from the buildings. That was a first really big step for a lot of our staff. Now we have to take the next step and get some of the kids into the buildings. Then we can take another step. And I'm going to say this again, the trauma that some individuals are going through, the fear and anxiety of being around others is not something we can take lightly. Even though I personally, our family has held out pretty well because we were lucky to have a pretty normal summer. But going into the school year, I can tell it is wearing on my kids, not being around their friends at school. So I really appreciate the methodological approach that we're taking to get everyone back in and having that really well-balanced step and approach to get the kids, the faculty, the staff, everyone comfortable and back in the buildings and not do harm to them that we're going to lose people and lose kids, not because of the COVID virus, but because of the mental health.
Okay, thank you for that. Mr. Turner, is there anything you want to add before we move on?
No, nothing to add, Mr. Chairman. Thank you.
Okay, thank you. I'll just do my best to summarize. Hopefully you hear our heart, our mind is to get back into school. We started down a path on August the 12th that we need to let play out a little bit. None of us love where we are, but we also don't want to rush into changing our plan yet again and having some portion of that change backfire. I think as you heard from Mr. Turner, as you heard from several board members, we want to get in the buildings and stay in the buildings. We think that's reasonable. So I can ask for a little bit of grace and time. That's, I guess, what I'm asking for. Trust the team if you can, please. Okay, so that brings us to item 10, information, proposals, communications. Does anybody have anything they want to share or highlight? That's right, the regional meeting, the 21st, I think. We had a lunch and learn yesterday that I listened in on, so it was pretty good. Finance related. Anything else?
I have a KSBA State Board of Directors meeting coming up on the 25th and 26th of this month. Part of it will be the Governance Committee meeting on association business. The Saturday will be a virtual meeting of the board. So anything that you would wish me to take to the state level from a KSBA advocacy standpoint, just let me know and I'll make sure it gets heard.
Oh, good. Okay, thank you. Item 11, closed executive session. We do not have a closed session this evening. That brings us to item 12, to adjourn. We'll take a motion to adjourn, please. Motion, Dr. Brown. Second. Second, Ms. Bird. All in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, motion carries. We are adjourned. Thank you very much. So I will call to order the Finance Corporation meeting of the Boone County Board of Education, September 10th, 2020. We have an audience of citizens on this meeting. If anyone would like to speak, this is for the Finance Corporation. Doesn't look like anyone wants to. Item 3, approval of minutes and financial statements. A and B, approval of minutes from last month, as well as approval of the financial statements. Mr. Turner.
Thank you, Mr. Chairperson. I recommend the board to approve the minutes of the August 13th, 2020 corporation meeting and the financial statements as presented.
Okay, thank you very much. I have a recommendation. Have a motion, please.
Make a motion.
Motion, Karen Bird. Second.
Second.
Mr. Fryman, second. Any questions, discussion? All in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, motion carries. I'm for adjournment. Could I get a motion to adjourn, please? A motion, Ms. Bird, second, Ms. Baum. All in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, motion carries. Thank you very much.